Hey, everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. We are back, episode 148 this week. A lot happening at the federal level, at the state level. Some juicy tidbits. Why don't we start with the big beautiful bill or the one ugly bill? Democrats have finally figured out how to brand something in a catchy way. And there's some infighting at the White House. How does that affect everything Medicaid and all the fears that we've had? Amina, why don't you just start out wherever you want as far as that's concerned?
Well, the state has already accounted for the uncertainty at the federal level, so they are anticipating that the legislature will have to meet later this year and possibly reopen the budget to discuss what is anticipated to be a significant cut in Medicaid pass-through dollars. And so at the federal level, it is very entertaining to watch in some respects, but largely it is very concerning because it will affect a lot of our clients. Taking it to the state level, we have just a few days left until June 12th, which is the scheduled end of the New York State Legislative Session. That does not mean that bills cannot become laws after that date, but it does become a bit harder to do that. Even after the budget, the rate of passage slows down significantly. So there are over 100 bills that are still open. Historically, 700 to 800 bills pass both houses of the legislature each session. So it is expected that there will still be close to 100 that will be passed in the next few days. Obviously, this number includes all proposals, not just those related to home care. But at a high level, here's what is still open as far as home care. And I will give credit to our friends at the New York State Home Care Association for putting together this very neat summary and breakdown. Number one, there is a CHA episodic rate proposal that was submitted to the legislature for consideration by HCA in conjunction with VNS and a work group to amend the CHA episodic reimbursement rate Medicaid rate methodology to authorize adjustments in the rates for costs not reflected in the reimbursable base year. If passed, this bill would also be available for payer provider use in rate setting for managed care. So effectively, as our listeners know, the CHA and Medicare supported rates are set differently than MLTC Medicaid rates. The Medicaid or MCO MLTC rates are more privatized. They are negotiated individually. Fee for service and CHOP cases, those rates are preset. There's very little wiggle room. So if passed, this could be used for managed care or for non-Medicaid home care payors. As we often talk about, there is this concept, this understanding that the reimbursement rate that the MLTCs have to pass down should be enough, at the very least, to cover the wage parity, the wage requirements, plus the reasonable overhead, inclusive of workers' comp, unemployment insurance, payroll tax. To my knowledge, and I've asked the associations for this confirmation as well, there is nothing explicitly stating that the plans are required to pass down this amount. So they have extremely broad discretion in what portion of the capitated rate that they receive to pass down to providers. So something like this would establish at least a benchmark for ensuring that providers are receiving enough in reimbursement from MLTCs. Now, since we're on the subject of MLTCs and reimbursements, Sasha, before we signed on, you and I were talking about what has been the topic of a discussion in the home care chat that nobody will let me in, by the way. If one of those people is a listener who is keeping me out, I will find you. I will find you. I know my name is mentioned in this chat, but to be clear, I am not allowed to go in there. However, I understand that there has been a lot of discussion this week about the MLTC rate cuts. I've heard as high as 6%. Can you confirm, Sasha, that this is what you're hearing as well? Since again, I cannot be in these discussions.
Well, I'll say what I'm hearing and what I'm seeing, and yeah, I mean, I think I've seen about the 5% in cuts, so we're in alignment, maybe doing a little better than some, um, but I don't think I've seen all the cuts yet come through. Hopefully, no more. But like you said in your presentation there, the is likeliness that either the legislature is called back in emergency in the fall to consider further cuts, or Governor Hochul is granted the executive authority to cut without having to come back to the legislature. So I don't know where we are with that request from her office. But this looks like it's going to be a pretty bloody year for home care. Luckily, uh, there's some infighting at the federal level, which may prevent this from going into place. And we can come back to that if you want. I mean,
So, have you been given any explanations for these rate cuts? Because I've heard two sets of excuses, really, or justifications for the rate cuts. One of them is we have to because our rate has been cut. The second one is we have to cut your rate because the state came back and did a retroactive cut on our rates. So we had to pay money back to the state, and now we have to recoup it from you. Have you heard what the justification
yeah,
is?
yeah. I mean, those are in line with what we're hearing and seeing, and I I tend to think that it's more proactive and anticipatory, and so they have reasons to, or a story that they can sell. Hopefully, this is it. In all honesty, hopefully, whatever they recoup in anticipation of a cut going into effect does not mean that they will come back to the well in the fall.
So interestingly, I have not yet seen whether KeyVAP, regular or enhanced, was refunded in the budget. I am still in vicious negotiations with SEIU 1199 about the 2025 rates for their health fund as well as the compensation rates. Those greedy jerks who really only care about their health fund being funded, and they don't really care about the workers and what they're taking home as pay at the end of the day. They seem to think that KeyVAP will continue, but I had heard that KeyVAP was not renewed in anticipation of these federal cuts. I mean, each year there's over $100 million in KeyVAP that is distributed to those agencies who are eligible. And again, eligibility was established over 10 years ago and never questioned again. When we talk about the feds investigating New York State, FYI, this needs to be investigated as well. So, the agencies that have received it have said to me over the years, the rates are so horrible. The costs increase, the rates decrease. That's obviously intentioned with any ability to make money. Our sole source of real revenue has been KeyVAP. So even for agencies that are not 1199 who are receiving that money, they're really worried about these cuts at the federal and state level because if KeyVAP goes away, significant profit goes away from them. But on the fairness side, you know my opinion about this KeyVAP stuff. It is not fair that the eligibility was established 10 years, over 10 years ago at this point, and that it is largely designed to benefit the union's health fund, which is still underfunded. Even with all of this taxpayer money, that union health fund is underfunded. Not to mention that only a third of the aides actually use it and care about it. The rest of them would much rather have their $2.20 or $2.30 that goes into the health fund for every hour. They would much rather have that in their wages. I've had some contentious discussions with the union, as I alluded to earlier, because as usual, they bully the employers. They really do. And I do blame a few of the larger providers who privately meet with the union ahead of any real negotiations. They cut a deal that benefits them, fine, whatever. But then the union uses that as leverage to push down that same contract and those same terms on the remainder of their 20 something agencies, as if what these seven Lixas signed off on benefits everybody equally, as if there is no competition among agencies for the workers or for the patients. But they just don't get that. They don't get that. And they don't appreciate that KeyVAP is not a dollar for dollar supplement as well. And it's useless to really talk to them about any of these issues because you're supposed to be bargaining. It's supposed to be a negotiation, take back and forth, give and take. It's usually take it or leave it. I will say, though, a few weeks ago, when Rona was fighting for her position, and as the prior SEIU president was fighting for his position, and he has since lost, BTW, he has since lost. Um, Rona was a bit more mum in the negotiations, and the workers were more proactive and talkative, and I actually enjoyed speaking to them. We made significant progress at the bargaining table when they had the opportunity to speak directly to me and to my clients instead of Rona's as the mouthpiece, who, by the way, has said before, the workers don't know what's good for them. It is my job to know what is good for them and to fight for it. They may think that they don't need the health insurance, but my job here is to preserve the health fund and secure this health insurance despite their wishes.
Yeah,
So,
I think your point, and we talked about the TVAP and the lack of fairness in that whole thing, right? Where small agencies seriously need to uh, join advocacy at some level because this is blatantly unfair, right? The fact that when it first came out, we received a check from Kivat the first
mm.
year, and then it was taken back. And then they said, "Oh, only union shops qualify." But as you stated, there are some bigger shops who are getting that money.
But they are
And so,
union, to be clear.
okay,
They are,
I thought they were
yeah.
non-union as well. So that's what I understood. It was all union, only union. So there are no non-union shops getting KVAP. The smaller medium-sized agencies need to get involved in advocacy because that's how you effectuate change. There, there is this big pile of money in Albany that is being allocated solely to these union shops. That's unfair. It's blatantly, patently unfair. So, how do you do that? You join an association. We're in the process of starting an association. Teaser, Fair Action Initiative, FAIR. Reform is the R in that. But we need to do something. We're going to advocate for big agencies as well as small agencies, but we can't sit on the sideline and and have a different playing field. And these union shops are able to speak with the plans and get preferred rates, not only because they have a larger census, but because they have relationships. As a business person, it takes years to develop those relationships. And should you benefit from those? Yes, but understand that it is not a fair playing field. We're not operating under the same rules, and we're not benefiting from the same pot of money. We're taxpayers. It's our tax money, right? As employers, as New Yorkers, that goes into this pot that they are redistributing to a select few. Absolutely unacceptable. We have to, as an industry, as agencies, do something about it. Make more noise because it's unacceptable.
Sasha, I cannot believe you just glossed over that whole, oh, we're forming an association. I want to hear more about this. Back up. Back
Okay,
up.
okay, okay. All right. So I said it was a teaser, right? So,
Don't tease
but
me.
okay, okay. Okay, okay. I'll get right to it. Okay. Fair Action Initiative is a new association for home care agencies that a few partners and I are in the process of standing up. And the reason why we think that there is a need for this is to target the needs of the industry along the continuum. We see what we currently have in the marketplace in the industry are associations that are closely tied to the plans or the CHAs, and there's a conflicts of interest there. Other associations have bigger players who that have more of a say and are leading the advocacy and supporting things that benefit the larger agencies versus the industry as a whole. We want to provide better care. And some of that requires money. Some of that requires proper allocation of funds. And as an industry, we need to show that we care about how the money is being spent, and that we also understand things from a department, from a bureaucracy standpoint, from a lawmaker standpoint. Listen, the politicians there are two things that they do: either try to save money or they're trying to get money either through taxes or federally to come to the state so that they can function. As an industry, all we keep doing is going to the state with our hands out, saying, please give us more money, please give us more money, please. And they're saying, hey, we can't, there's no money here, there's no money. Okay, we need to be in there and in the conversation prior to the laws being written. Right, as you know, this association, we will have an in-house lobby group. We will have opportunities to align ourselves with the managed care. We'll align ourselves with the unions if we need to. They'll be outside contributors, if you will. And where we align, we'll work on those laws, right? This is, for me, the best example of why when I was tapped to join this movement, I decided to go all in. Last year, when it looked like the legislators are going after the MLTCs, the managed care organization, they put out letters and reached out to all the agencies to sign letters of support. And a lot of people did. And they killed the bill that was going to or was aiming to close down the MLTCs, go back directly to DOH Medicaid. But when they killed that bill, we saw a pivot, and I recall there's a $250 million savings that they were looking to get, and then when they pointed at FIs, that same 250 number was thrown about early on. So it looks like they just shifted the aim of the barrel towards CDPAP. So if the MLTCs are able to do that with our support, we should be able to, as an industry, be strong enough to be peers. We have to be peers of these MLTCs and not just providers that they can sick their dogs on. No, we need to come together and become a powerful force and a go-to association for these politicians when they're coming up with laws. Lastly, I'm going to close with this on this point about fair. For those agency owners who don't want to join an association and think, oh, they're going to take care of it. Why do we join? What does it matter? Those few will take care of it. How did that work out for you in CDPAP? It didn't, right? We know the Elixir RFO is still pending. How did it work out for you when you didn't join an association, when you didn't join the advocacy? I shouldn't be arguing this point and trying to convince you. It didn't work.
I will tell you this. There are definitely levels of cultural and ethnic suspicion or distrust of any groups. And it may not even be a financial thing. It is simply a cultural or ethnic type of distrust of any organized movement. And people prefer to keep to themselves, just pursue their business. However, I do agree with you that the last few years have been very difficult for the industry and that you are not, I will echo what you have said. It is difficult to effectuate change unless you have a lot of loud voices. Okay. And it doesn't, we had Alyssa Lovelace as a guest a few weeks ago, and she said advocacy is not just when the budget season starts in January. You need to lay the groundwork year round so that when you do need to go in and talk to one of these legislative officials about your agenda, they know who you are. You've already laid the foundation, right? They know who you are, they know what you do, they know how you get paid. They have some basic understanding of the numbers because everybody is coming to them and asking them for money. It all boils down to numbers and priorities, okay? So I hope you do have success. Just to clarify, you will be competing with the established home care associations already, the likes of HCA, HCP, CDPAP in this membership. I mean, I understand that is not the reason why you formed this. You're forming it, as I understand it, because there's a need. You believe that there is a group of providers who have not been heard and whose interests have not been reflected so far in the advocacy efforts. And this group is just pissed off, for lack of another phrase, at what has been happening and is sick of it and wants to be able to proactively counter against any further cuts or damage against providers.
I take your point about the ethnic hesitancy, let's call it, right? Like I'm my mother was, was born overseas, came here, we're born here. And one of the things that you know always stuck to me was how little I understood the system and how long it took me. Right? It took into my 20s and 30s, like, oh my goodness. Now I feel that I kind of understand the system. And I'll say kind of because there's, obviously things you still don't know. I'll look at my household and what I try to impart on my kids. And like it's like, we try to get our kids to listen to us as parents. Sometimes they do, sometimes they don't. I'm like, listen, if you would just listen to me. I wish I had somebody to do that for me. And that's what happens when you are generationally American. You have people in your family who can impart these things. And yeah. So if you are for whatever culture, get over it. No, be like what the conservatives do. Like, yeah, become American. If you, as a business person, you can be cultural at home all you want. As a business person, become American and work the system the way that it is designed to, because it's not working the way that we're doing it.
I will say when you look at ethnic differences, I'm talking about companies that are owned and run by individuals from countries that are still dictatorships or have a strong history of dictatorship where government and organized action was suppressed, criminalized. I'm talking about folks who came over from one of the Soviet countries, right? Soviet bloc countries or China or Latin America as well, where they had to deal with all sorts of corruption on the government side. So I don't want to undermine the legitimacy of the distrust that these folks feel, but I do hope you will be able to reach across those obstacles and convince these folks to engage because they are a huge contingency of the home care provider community that just has not stepped up and has really just had to deal with whatever was laid out by the legislature so far. All right, we have to move on in the interest of finishing this show sometimes. I do want to talk about the article that came out in a post this week that the feds are investigating Hochul and have been for quite a few weeks. I can't say it's a surprise to me. They're investigating the award to PPL of the CDPAP contract. And they are already stating to the Post that they anticipate criminal and civil action. Now, I haven't heard anything from the governor in response to that article. Perhaps she's busy trying to finish up the legislative session. but I'm sure she's afraid because Trump is a vicious guy. He holds grudges. And his FBI, his OIG, his Department of Homeland Security, they ain't all there. I mean, that's the problem. You can't trust the law to protect you, Hochul. You know, these people don't follow the law. So I don't know. To my knowledge, she hasn't said anything, but I would be afraid if I were her.
Yeah, speaking of criminality, right? That's this that's the transition. A lot of the stuff is spectacle. We come to understand, right? It's noise until something happens, right? Look, I mean, look at the bill by Rivera and Paulin, I believe, right? Where it's rumored that that was all for show,
Yeah.
and they know it's not going anywhere. Okay, so politicians feed you things, and there's the spat between Elon and Trump, where that's spectacle because they're trying to pass another bill to codify these cuts into law, right? Where permanent elimination possibly of some of these Medicaid spending. Right? It's a 50 vote majority, so it could be overturned. But still, in that time, until it's overturned, you have issues. Again, I think this was the whomever got to the administration, with the big donation, this whatever crypto, whatever they did to get in the room, and they asked for something to be done.
No,
If
I mean,
this
let's return. I'm not sure what you're referring to with the Elon Musk mention and all of that. However, what I want to be very clear about, and let's return it back to the conversation about this investigation on the PPL side.
Right.
Um, First of all, I don't think this is solely for show. I do know that there were a number of very powerful provider players who made sure that the Health and Human Services Secretary got involved a little bit too late because they waited for the Trump officials to get settled in and start going. As you know, April 1 came pretty quickly. But I do know that the cooperation was expensively secured. And so the feds can't just say, oh, we're just investigating this for show. No, they're going to be held accountable to the people whose money they took to investigate it. And I don't think it's just smoke. I do think that there will be some prosecution of individuals. It may ultimately not be decided by a jury. It may ultimately be settled. But just the fact that you indict someone and accuse them and order them to rescind this whole PPL fiasco, that will be a victory.
Yeah, no, sure. I mean, it's a victory in that they dismantle and allow you to get back in business if you're able to, right?
Yeah.
But the show part of it to me, and that's why I alluded to the other things, was that yeah, it didn't come before the date. Logistically happened because it was too short a period of time. Unless a judge put a stay, that would have been the thing that was non-performative. Now it's performative after, but with possible real results. Like, let's hope. We'll see. We just got to keep some money aside for if we can jump back into this thing, and then we'll see what happens in the future. I've experienced too much performance to seriously be um, optimistic, and I'll leave it at that.
All right, folks, we have certainly deviated from the path that we set out on at the beginning of this. I started talking about the pending legislation that still may or may not pass before the legislative session ends in a few days. So let me just wrap that up very quickly. There is a mental health home care collaboration bill that is also pending. This would provide greater flexibility to facilitate collaborative care between mental health professionals and home health agencies, right? CHAs, not LICSAs, to deliver seamless coordinated care to individuals with co-occurring conditions. Mental health is huge. Those of you who are looking for new avenues of business as the LICSA business gets tighter and tighter, do look at mental health. There are a number of federal and state programs in that space, as well as substance abuse. I don't know as much about the reimbursement rates, but it is something that both the feds and state are heavily investing in. So that's definitely something you should all be looking at. There is a workforce labor market analysis proposal as well that has been put out by Brunson. The bill would require an analysis of the competitive labor market for home care and hospice. It would require recommendations to be made as to the level of reimbursement that's needed in the system to enable providers to recruit competent staff to meet community need. I mean, this is something that's regularly talked about as needed because we are constantly talking about shortages. We're constantly talking about lack of training and competency for the home health aides who are going into the field. This would actually just provide a firmer market analysis for the state to inform any of its decisions on how to invest all of these monies, that millions really over the years that have been devoted to workforce development. Next, there is also a bill pending that would improve the process for filing the LICSA statistical report with the DOH. It is on the Senate calendar. We don't know if it's going to pass. There is a bill that would authorize the State Department of Veterans Services to consult and collaborate with the Federal Department of Veterans Affairs, the DOH, the State Office for Aging, and other home care-based service experts to develop educational materials for vets and their families. I am surprised that there are insufficient numbers of educational materials already, frankly, but okay, that bill is out there. And then the hospital home care physician EMS collaboration model bill. This is something that Sasha has talked about many times. The bill would authorize EMS services to hospital home care physician collaboration program for a jointly partnered collaborative community medicine and paramedicine service opportunity. The bill is still in the Assembly Health Committee. It doesn't look like it's moving further. And it's on the Senate calendar. I think this is not going to go through. It's another Rivera-Paulin collaboration. I suspect, nope. There is a bill from Paulin and Rivera, our famous duo, that would repeal the section of the law that would require authorization for Alexa to enroll as a provider under the Medicaid program. The associations have opposed this RFO-like law from the beginning, and they continue to fight against that bill. So what Rivera and Paulin are proposing is basically a way to strip that law of its impact, of the RFO-like impact on Lexus. There's a newly introduced bill that would add home care visits to existing provisions of the law that prohibits healthcare employers from requiring a nurse to work more than the nurse's regularly scheduled work hours, including regularly scheduled home visits. This bill really does not apply in the home care setting. It is largely applicable to hospitals. It's an old law applicable only to nurses. I have not seen it applied in home care ever. So frankly, I mean, this is why this is a joke. Ramos is one of the sponsors. The lady who wants to be the New York City mayor, the woman is a joke. She proposes all of this labor legislation without knowing what's actually out there, what's on the books, where the holes are. This bill is not needed, lady, because this bill that you're trying to fix only applies in the hospital setting. Go away. Stay in your lane. I don't know that this is going anywhere because it is not needed. It is not applicable to home care. But okay, Ramos, I see you still there. Still trying to climb. There's another bill that was previously introduced to replace the state FI program with a state licensure program that would allow multiple FIs. Sasha was mentioning that earlier on the episode today. We don't think any of these efforts to repeal the single statewide FI are going to work. I mean, with some of this pressure about the federal investigators breathing down Hochul's neck, I do wonder if she's thinking about this now, maybe this week, whereas before she didn't. I haven't heard anything from her office. It might look bad if she all of a sudden did a turnaround. I will say on the PPL front, I continue to monitor the chats. The pay practices of that business are highly questionable. There are still many consumers who have not switched over. Cranes did a feature today that said 77,000 caregivers who were previously in the CDPAP program have now switched out. That seems a little bit high to me. If I think what is more likely happening is that this number includes people who are trying to get onto PPL's platform so they can work. So that's a huge number. And I do question their numbers as well because most of these people are just trying to get through to PPL. They're not filling out surveys about who they are and where they are. So I have no idea how they even came up with that number. And then there is a bill that would establish a $5 million preceptor stipend program for clinicians that are accepted into the program, and they would provide clinical mentorship. It's $5,000. I applaud the effort. I mean, this is a similar stipend program that has been introduced before and didn't go anywhere. There's an aid in dying bill that Paulin and Heilemann Segal have recommended. It would provide for the ability of mentally competent, terminally ill patients to request medication to hasten their death. And then last but not least, because this is an important one of my dear friends is regularly talking about this. It's a prohibition on for-profit hospices bill by Kruger and Paulin. It would prohibit the establishment of new for-profit hospices or increasing the capacity of existing for-profit hospice organizations. It passed both houses. There's a lot of support for this concept. Hospice should be a nonprofit or a limited private venture. It has not been delivered to the governor for her consideration. However, she did veto similar bills in the past, in 2022 specifically. So we'll see what happens.
Lastly, I want to touch on a couple things. Emina is an expert in the FLSA space, but the United States Department of Labor Wage and Hour issued on May 1st, 2025, their field bulletin on the parameters of contract workers. Now, it's not going to affect New York State because New York State is more stringent, but there are employers who don't know or don't necessarily follow New York State's regs to a T. So, the questions are around does the employer retain power to select the servant or engage the contractor? Does the employer select the method of payment for the contractor? Does the employer have the power to dismiss the contractor? Does the employer direct and control the contractor's activities, right? So all things that are already present in New York. And if you're not familiar with, or if you think you are operating in a gray or outside those lines, contact your attorney.
Sasha, that's an excellent point. And thank you for triggering something in my memory because I get one of these questions at least every week. Can I pay my nurse on a 1099 basis? The answer is no. It doesn't matter if Trump is in the White House or if Biden is there or someone from Biden's camp. The fact is, if they are servicing your patients, they are working for you. They are not in business for themselves. There are a number of factors that Sasha just recited that will go into this equation about whether they are truly a contractor and should be paid on a 1099 or a W-2. But at the end of the day, it boils down to the question of, are they in business for themselves? If they are, they should have their own patients. They should not be servicing your patients. And it doesn't matter if they are per diem, part-time, or they have other jobs. None of this matters. It doesn't matter if they want to be a 1099. Of course they do, BTW. Of course they do. As Sasha said, consult your counsel. This is the most common scenario that we see this issue arise in with respect to nurses. And at any given time, I have at least one litigation or audit involving these classifications. So it is not a matter of, am I going to get caught? It's a question of when you're going to get caught and whether it's going to be US Department of Labor, New York Department of Labor, class action lawsuit, yada, yada. And also, as a, by the way, LPNs who are doing PDN care are never, ever, ever, ever going to be 1099s, okay? RNs, there's a small chance, but maybe we get them there. LPNs, never, okay? Thank you, Sasha, you may resume.
Okay, thank you. And I'll close out with this morning's presentation where the New York State Medicaid billing process is being updated for the NHTD and TBI providers effective July 1st, 2025. This is really an addition of billing codes. They're trying to do is just get consistency across the board, similar to the TBI program, instead of individually coded per provider, right? So starting at 12:01 a.m. on July 1st, 2025, you will need this new billing methodology, right? So there was the presentation this morning. Hopefully your billing companies are familiar. I definitely checked in with ours, who's AZ Billing, and they were on it. But if you're billing internally, make sure you are following that. There should have been an email that went out. If not, reach out to the NHTD TBI programs and make sure you are aware of that. So that is it for us this week. This has been the Home Care Forum podcast with your hosts, Sasha Guillaume and Emina Poricanin. Have a good one.